Subscribe for more information. Introduction to Polycystic Kidney Disease. Polycystic kidney disease, often abbreviated as PKD, is a genetic disorder that causes numerous cysts to grow in the kidneys. These cysts are non-cancerous, fluid-filled sacs, but they grow over time and can disrupt normal kidney function, leading to chronic kidney disease or even kidney failure if not managed properly. PKD affects millions of people worldwide and is one of the most common, life-threatening genetic diseases. Today, we'll explore PKD in detail, its causes, symptoms, types, diagnosis, and treatment options. 1. Understanding PKD. What causes it? PKD is primarily a genetic disorder, meaning it's usually inherited from one or both parents. The disease has two main forms: autosomal dominant polycystic kidney disease, ADPKD, autosomal recessive polycystic kidney disease, ARPKD. The difference between these two lies in their genetic inheritance patterns. In ADPKD, if one parent has the disease, there's a 50% chance that each child will inherit it. ADPKD is the most common form and usually begins in adulthood. On the other hand, ARPKD is less common but more severe, and typically appears in infancy or early childhood. Both types are caused by mutations in certain genes responsible for kidney, cell growth, and division. These gene mutations disrupt the normal function of kidney cells, causing abnormal cell growth and cyst formation. Over time, these cysts enlarge, affecting kidney function and possibly causing damage to other organs. 2. Symptoms of polycystic kidney disease. PKD symptoms vary from person to person and depend on the type and stage of the disease. In the early stages, PKD often has no symptoms, making it hard to detect without specific tests. As the disease progresses, symptoms start to appear. Some common symptoms include high blood pressure. This is often the first sign of PKD and can worsen as the disease advances. High blood pressure can cause additional damage to the kidneys, accelerating the progression of kidney disease. Back or side pain. The presence of large cysts can lead to chronic pain in the back or side, especially as the cysts grow and put pressure on surrounding tissues. Blood in the urine. Hematuria. Ruptured cysts can cause blood in the urine, leading to pain and potential infection. Frequent urinary tract infections, UTIs. Individuals with PKD are prone to UTIs, as bacteria can sometimes enter the cysts, making infections harder to treat. Kidney stones. Cyst formation can lead to imbalances in the body's chemistry, increasing the risk of kidney stones, which can be painful and difficult to pass. Abdominal swelling. As the cysts grow and multiply, they enlarge the kidneys, which can lead to a noticeable swelling in the abdomen. In ADPKD, symptoms usually develop between the ages of 30 and 40, but they may start earlier or later depending on the individual. In ARPKD, symptoms appear early in life, sometimes even before birth. 3. Types of polycystic kidney disease. There are two main types of PKD, each with its own characteristics. Autosomal dominant polycystic kidney disease, ADPKD. This form of PKD is the most common and affects about 90% of people with PKD. It's a dominant genetic disorder, meaning that inheriting one defective gene from either parent can cause the disease. ADPKD tends to progress slowly, and many people with ADPKD may not experience symptoms until adulthood. Autosomal recessive polycystic kidney disease, ARPKD. ARPKD is much rarer and more severe than ADPT. Both parents must carry the defective gene to pass it on to their child. Children with ARPKD often develop symptoms at birth or within the first few months of life. ARPKD can lead to severe kidney and liver damage and has a high risk of complications early in life. 4. Diagnosis of polycystic kidney disease. Diagnosing PKD often begins with a physical examination, medical history, and family history due to its genetic nature. There are several tests and procedures used to confirm a PKD diagnosis. Imaging tests, ultrasound, CT scans, or MRI scans are commonly used to detect cysts in the kidneys. Ultrasound is often the first Imaging technique used as it's safe and non-invasive. CT and MRI scans provide more detailed images, which are particularly useful in cases where cysts are small and hard to detect. Genetic testing. For families with a known history of PKD, genetic testing can identify PKD mutations before symptoms appear. This test is especially helpful for individuals who may want to understand their risk of passing the disease to their children. Blood and urine tests. These tests help assess kidney function by measuring waste products, electrolyte levels, and proteins in the blood and urine. High levels of creatinine and blood urea nitrogen, BUN, can indicate reduced kidney function. Early diagnosis of PKD allows individuals to monitor their kidney health and take steps to manage the condition, slowing disease progression. 5. Treatment options for polycystic kidney disease. There is no cure for PKD, but treatments focus on managing symptoms, slowing the progression of kidney damage, and preventing complications. 1. Managing blood pressure. Controlling high blood pressure is crucial in PKD management. Medications like ACE inhibitors or angiotensin II receptor blockers, ARBs, are often prescribed as they can slow kidney damage and reduce the risk of cardiovascular problems. 2. Pain management. For those experiencing chronic pain due to cyst enlargement, over-the-counter pain relievers like acetaminophen can be helpful. In severe cases, surgical procedures may be needed to drain or remove large cysts. 3. Managing infections. If an individual with PKD has recurrent UTIs, antibiotics are prescribed. It's important to treat these infections quickly to prevent further kidney damage. 4. Reducing sodium intake. A low-sodium diet can help control blood pressure and reduce kidney strain. Avoiding processed foods and choosing fresh fruits and vegetables are good ways to reduce sodium intake. 5. Lifestyle changes. Maintaining a healthy weight, eating a balanced diet, quitting smoking, and reducing alcohol intake can all contribute to kidney health. Regular exercise and hydration are also beneficial for overall kidney function. 6. Dialysis and kidney transplant. In severe cases of ADPKD or ARPKD, kidney function may decline to the point where dialysis or a kidney transplant is necessary. Dialysis helps filter waste from the blood, and a transplant can replace a failing kidney with a healthy one. 7. Emerging therapies. New treatments for PKD are being researched. For example, tolvaptan, a medication approved for ADPKD, slows cyst growth and kidney function decline. Research continues into other therapies that target specific pathways involved in cyst growth. 6. Living with PKD, coping and support. Living with PKD can be challenging, both physically and emotionally. Here are some tips for managing the disease and maintaining a good quality of life. Education and awareness. Understanding PKD and its impact on your body empowers you to make informed decisions about your care. Support groups, PKD. Support groups and organizations provide a community where people can share their experiences, advice, and encouragement. Mental health care. PKD can be emotionally challenging. Speaking with a counselor or joining a support group can help individuals and families cope. Family planning. For those with a family history of PKD, genetic counseling can provide valuable information for family planning and understanding the risks for future generations. Conclusion. Polycystic kidney disease is a serious genetic disorder that affects kidney function and overall health. While there is no cure, early diagnosis, lifestyle changes, and appropriate treatments can help manage symptoms and improve quality of life. Advances in research offer hope for new therapies that may further slow disease progression and minimize complications. If you or a loved one has PKD, staying informed, seeking medical advice, and joining supportive communities can make a positive difference in your journey with this disease. Thank you for watching, and remember to take proactive steps to support your kidney health. Subscribe for more information.